Thank you everyone for joining us for our webinar on health and wellness. I'm Margot Early from the Metro Hartford Alliance, and before we officially get started, I just wanted to go over a couple of housekeeping details with you. All participants are muted on this webinar. However, you can use the Q&A module to ask questions. Please use that instead of the chat box. Questions will be answered at the end of the webinar. We've allotted about 15 minutes near the end. Videos and slides, if appropriate, will be posted to our preparedhartford.com website. We'll also be sending out a follow-up email with additional information and links. And please feel free to use the chat box if you can't see or hear something. Right now, we are going to move on to Amy Cunningham, who is going to kick us off. Amy, you're muted.
Welcome everyone and good afternoon. Thank you all for joining this afternoon. My name's Amy Cunningham. I'm the Executive Director and Vice President of the Metro Hartford Alliance and Connecticut Health Council. I want to share with all of you a brief description of the Connecticut Health Council. The council was founded in 2012 as an initiative of the Metro Hartford Alliance. Its members are a group of health sector leaders who work in advance to develop businesses, initiatives, and technology to improve healthcare and wellness in the region, state, and nation. I would now like to take this opportunity to introduce our moderator for today. Coleen Mcquarrie is the co-founder and Chief Executive Officer of SilverFern Health. Colleen brings more than 30 years of business experience to the company, as well as a passion for healthcare reform and a commitment to addressing the unmet needs of people with chronic illnesses. SilverFern partners with payers, providers, and employers, bringing their first-to-market products that address the individual behaviors and social environmental factors impacting patient success, which account for 60% of health outcomes and have gone largely unevaluated and untreated in the current system. Colleen earned her MBA from Harvard Business School and is a chartered financial analyst. Welcome, Colleen, and thank you so much for moderating this discussion today.
Well, thank you, Amy. I'm delighted to be here. This is a very important topic. And so I'm really, really honored to be moderating. And so without hesitation, let me go ahead and introduce our three panel speakers. First, we have near on the screen here at the bottom, Dr. Timothy Kearney. Dr. Kearney is the Chief Behavioral Officer, Health Officer of the Community Health Center. Dr. Kearney earned his BA in psychology and with a Spanish literature minor, I believe, at Yale University, and then pursued his theological work at the Fuller Theological Seminary. And he did his PhD at MA Theology, and of course is a psychologist. And so Dr. Kearney also is the author of Caring for Sexually Abused Children, a handbook for families and churches. And as a provider, he provides direct client care with a clinical focus of providing care to children and adolescents and their families, especially those impacted by medical illness, trauma, and abuse. And as part of our panel today, you will see that Dr. Kearney is a strong advocate of whole health and a holistic approach. Second on our panel is Andi Campbell. We're delighted to have Andi today. She is the SVP of People and Culture at Laz Parking. Andi is a workplace behavior expert and has an emphasis in strategic talent management. As an SVP of People and Culture at Laz Parking, she leads human resources for Laz's 15,000 employees across the U.S. Andi has a number of wonderful accolades here. She was named as one of the top young trainers by Training Magazine. She was named as Game Changer by Workforce Magazine. She's done a TEDx talk here in Hartford recently, and also was a speaker at Disrupt HR 1.0 in Hartford. So welcome, Andi. And then last but not least is my good friend, Bert Wachtelhausen, and Bert is the president of WellSpark Health. Bert is the visionary and strategic leader of WellSpark Health, a Connecticut subsidiary and part of the Emblem Health family of companies. Bert was recently named in 2020 as a distinguished alumni of UConn's NEAG School of Education, and she was also recognized as the 2019 Chief Marketing Officer of the Year by the Hartford Business Journal. So welcome to all of our panelists. I'm not going to delay here. I'm going to jump right in. Let me start by essentially teeing up this conversation that we're having, which is entitled, again, Supporting Your Employees with Better Health and Wellness Models. So we know that many studies show that stress impacts Americans and the American workforce. According to the American Institute of Stress, 83% of U.S. workers report suffering from work-related stress, and the cost of this stress to U.S. businesses is up to $300 billion annually. 75% of workers believe that they are more stressed out than their previous generations. Depression and loneliness have emerged as critical issues identified by workers. These issues have been are amplified in people with chronic diseases such as diabetes, those with cardiac issues and respiratory problems such as asthma. Programs currently in place are not designed to deal with the convergence of physical, psychological, and social needs. Over the last several months, we know that COVID-19 has further increased the stress levels and has illuminated areas where we are falling short in helping to offer tools and solutions to our employees. We're here today to discuss whether the American businesses need a new model in a post-COVID-19 world. Models that focus not only on the physical aspects of health, but also on the social and psychological aspects of well-being. Models that support the whole person. So I've done formal introductions. Now let me get a little bit down into the meat here. Here with me today are three people that see these issues from different lenses, right? So Dr. Kearney is a psychologist focused on treating the community's most vulnerable patients in a clinical setting. Andi is a national employer headquartered here. Laz is a national employer headquartered here in Connecticut. And so Andi is obviously a senior member of that, of Laz, bringing innovative programs that drive cultural change and leadership skills to a diverse workforce. And we have Bert, who is a leader of a disruptive company focusing on delivering programs to meet the needs of today's workforce. So with that, let me start the conversation and ask each of you the same question. I'm going to go around and ask, what are you all seeing in your organizations? So Dr. Kearney, I'd like to start with you and ask you, as a provider and someone right at the front line here, what are you seeing these days at your center?
Okay, great. Well, thank you, Colleen. It's a pleasure to be with all of you and be part of this panel. And this is the perfect time to be doing this conversation because COVID-19 has been a tremendous disruptive force for us all, both on the personal level and on a broader sense to our whole health system, and presents us with some great opportunities to think through new models and new ways of approaching things. So I'm really looking forward to a stimulating discussion and also to the questions from the participants at the end. So as was mentioned in the intro, I'm a clinical psychologist. I've been in practice for about 35 years, and the last 22 have been at the Community Health Center. And over that time, I've been part of the development of our integrated program where behavioral health and medical are provided in the same facilities, in the same hallways, in the same waiting rooms, all that. We'll get into some more detail later about the model that we are doing. But suffice it to say for right now that we are a statewide network of primary care centers that provide behavioral health, medical, and dental care. We're also in about 100 schools doing outpatient therapy and medical care in the school settings and in domestic violence and homeless shelters around the state. So a lot of different perspectives, a lot of different ways to see what's going on. And before I get into more detail about what we're seeing, I want to say a little bit about what we're all experiencing, because I think from a behavioral health perspective, that's really important to talk about. As a community, as we walk through this COVID pandemic, what we're really experiencing is a joint trauma. Much of my clinical work is focused on traumas over the years, and we're all experiencing trauma right now. For some of us, it's the personal trauma of illness or death or loss of job, facing threats to food, facing threats to housing security. But for all of us, it's been a disruption of our lives, changes both good and bad, and the whole secondary trauma of hearing about other people's trauma, which has impact on us as we hear about it, whether it's through the news or however else we find out. So all of the symptoms of secondary trauma will sound familiar. Irritability, sleep disturbance, tiredness, need to just zone out, inability to concentrate. All of those are things that are recognized symptoms of what happens if you're experiencing trauma, either firsthand or from others, hearing about it from others. And that's what we're all right now. So in the context of my work, what I'm seeing, and not just myself, but the residents I supervise and the 200 or so behavioral health providers we have working normally in all those settings I mentioned, but right now, all of us remotely, we're seeing everybody is feeling increased stress, exactly as was mentioned at the beginning. Folks that have been doing well all along, we're kind of fraying at the edges right now, whether this is showing in relationships or in work settings, wherever else it may be. Many of our medical patients, and we share patients with our medical providers, the primary care providers, many of our medical patients are asking their primary care providers, hey, could I see a behavioral health person? Even just a couple of times to sort of sort out what's going on with me. We've had about 1,700 requests since we went mobile or remote in the middle of March, and have picked up people that some of them talked to us just once or twice just to figure out what's going on, and just the reassurance that this is a normal response to an abnormal situation is often enough for a lot of people. But then there's a whole nother category. Those folks that already had pre-existing behavioral health conditions, may have been in treatment with us, may not have been, but have had those pre-existing conditions. And what we've seen is people can go one of two ways. For a lot of folks, it's a lot harder. The supports that were in place, the treatment that they were getting provided, whatever else might have been there that's disappeared, even just normal daily social interactions that mean so much to all of us, as those have changed or vanished, and those disruptions have caused more stress, there's been more illness. However, on the other hand, there are those who the changes that have been brought about in our culture have really been beneficial. There are people who are feeling less stress. For instance, I do a lot of my work with children. A child who is being picked on and bullied at school might find that working remotely is a whole lot better, a whole lot easier. And so there's things that it goes both ways. But the point is that everybody's experiencing a tremendous amount of change right now, and especially this week, as we're looking forward to Connecticut opening up with some anticipation and with also some fear. So let me stop there and I'll hear what other people are finding where they are.
Thank you, Dr. Kearney. That was really terrific. There's so many things that you introduced that I personally don't know. I hope we have time to come back to things like secondary trauma, which is a new concept to me. So with that, I would like to move to Andi. Andi, I'm wondering if you can share with us your perspective from a national employer's point of view.
Thank you, and humbled. Thank you, Bert, for introducing me to Colleen. Thank you, Colleen, and to be with everybody today. Humbled to have the opportunity to share some perspective and appreciate that I've been included. So a few comments I would make is, you know, I think holistically as an employer, we're in, and most of us are experiencing this as being employed by an employer. We're having an entirely new set of responsibilities in the way in which we interact with each other that were almost socially unacceptable in the workplace in the past. And so I think if I had to summarize in a few sentences or a few words, phrases, how I would consider what I'm seeing is a sense of humanity coming back and a deep vulnerability. We're exposing ourselves in an entirely new way. Like right now, I realized my dog is under my desk and I forgot to put him upstairs before we started this conversation. So as an example, and he just sort of started making some noise down here. So as an example, you know, you're in dialogue with people whose you know, children are stopping in the middle of a call, or who have to step away because their dog is barking, or whatever else is going. They, you know, they didn't realize today was the day on video, and they didn't do whatever needed to get done to be presentable that we would do. So deep sense of vulnerability, but also coming with that a beautiful openness in the way in which we're interacting with each other and connecting with each other at work in a way we never have. I mean, exposing ourselves in what I would consider to be a deeply human way. In addition to that, I think employers are, and you know, speaking about labs, we'll get to the what we're doing later and a little teaser there, but I think there's a purposeful, deliberate, grounded, these are the words I think of when I think of what we're seeing right now. We have to be more purposeful. We have to be more deliberate. We have to make different kinds of choices. And that, you know, in general, and it particularly as Dr. Kearney alluded to with Connecticut kind of coming back to life, and I think for me as obviously being part of a national employer, this has been happening over the course of the last few weeks. But, you know, I think there's a lot of people who are really scared because they've been feeling very safe in their new routines. And what I mean by that is psychologically safe, specifically around the idea of, you know, like, I didn't have to go to that networking event after work because it's not happening. So those people who have the social anxiety and I'm speaking for myself, you know, there's moments I should have done this or I should have done, like our shoulds are out the window because nobody's doing those things anymore. And so there's an anxiety in going back to work, and particularly those of us in HR who are planning for that, for our safety and health of our employees as people come back to work. You know, the considerations and the dialogue that we're having is so much more focused on the idea of people's psychological safety. Forget about physical safety, that's a given in COVID, but psychological safety in a way that I think is it will be so impactful for many years to come. So I'd say in summary, you know, groundedness, vulnerability, deep openness, connection in a way that I think we have such an opportunity to start to move the needle as employers, particularly, and take more responsibility in making healthcare as a model, holistic healthcare, more accessible, which I know we'll get to talk about a little bit about what we're doing at LAS as we go.
Beautiful, wonderful. Thank you again for your perspective, Bert. As a disruptor with a wellness organization, can you share your perspective with the group?
Yes, thanks, Colleen, for the introduction. And I just got a notice, timing is everything, that my internet connection is shaky. So Colleen, I'm giving you permission to move along if I start to freeze up. Fair?
Okay.
So if we step back as a company, I actually think in the past couple of years, our clients have been asking us to deliver they use the words, a more meaningful wellness program. And we have had the belief for some time that you can't just focus on the physical, the outcomes are significantly improved aspect of what's going on in a person's orbit. So we have been on a path for some time to deliver that kind of program. Our coaches and nurses are on the front lines working with folks, and we're using very focused behavior diagnostic tools, SilverFern in particular. We are using those tools with our participants And we're unlocking all sorts of things that are at the root cause of why. What we need to do is, I'll say there's a gap in the market. There's a gap in the employee benefits suite right now. The classic set of benefits that we've had in market for years. You have health benefits, you have EAP benefits, you have behavioral health benefits, and it's been a fragmented approach addressing employee issues. And so what we're doing is we are bringing these together in a consolidated way so that when our coaches and nurses are working with folks, we're actually helping. Before we move to the additional questions, Colleen, an example of this is we have a customer who's about 500, 600 employees. And when they went to 100% working remotely, you would think, this is the biggest stressful event perhaps in people's careers, and having to do all the things that Andi was talking about. And you're isolated, now you're cooped up with your family, and all that goes with that. And what we're seeing is, with this particular customer, looked at the data for that time period and found that out of 500-600 people, only 3 people called the EAP line. So we know that they're dealing, everyone in a workforce is dealing with things in their orbit. Employee benefits offerings are falling short, and you need a combined approach and a hybrid approach to address the biopsychosocial aspects of what someone's dealing with, if you're really going to affect outcomes like improvement in medical costs or even return to work and absenteeism. So I'll pause there and let you get to the rest of the show.
Well, that was terrific, Bert, and it's a wonderful segue to, and you've all touched on this just barely, I think, but I'd like to get to the next question, which is, so what are we doing about this? How do we move forward in a post-COVID world and make sure that we're attending to the whole person, to not only the medical needs, that is really what has been our focus, in the acute care needs for years. And so what are we suggesting that we do as we go back to work? And maybe I could start with you, Andi. As you said, we've got people coming back to work, and they're stressed from the employees, and there's stress at the employer level as well. So maybe you could kind of kick us off on this question.
Thank you. Sure. So I think if I had to, I'm going to start with that at the macro of macro, all levels, macro, and say that, I think there's a concept that we forget about, which is we can support the individual and through benefits and through coaching and through, mental health support and all kinds of, things that we do to support our individuals. But I think the key and the things that we are, I think, exceptional at LAS at doing for our employees is that we have to create a model where the organizational systems and infrastructure are supporting the individual's well-being. And so, for example, if you're offering wellness coaching, or you're offering, mental health support, you're offering free preventative service, or whatever it looks like for you in your benefit suite, you've got to also remember that at the organizational level, your culture has to support that. Are your leaders, do your leaders know what to look for as it relates to substance abuse or addiction, or how to refer somebody to an EAP or to a human resources group? Do your leaders know that preventative care is free and we should encourage people to take time off to do that? Do your leadership development programs integrate the whole person? And are we having human dialogue, really bringing our humans back to work through our leaders? And when I think about it as an employer, like, our key to driving better practices, improved processes is always at that frontline, mid-level manager, group. And so what happens, I think, is benefit departments and HR departments and OD and, chief learning officers, they're all spending all their time worrying about the individual, moving the individual. And same with HR, but they're doing it in parallel, and there isn't an intersection. And so, in summary, what I would say is probably the biggest key, and certainly we have tons of programs at LAS, which if there's time, I'm happy to share a few specifics, but at the highest level, the interrelationship between your leadership development programs, your everything that you're doing within your organization to cultivate your culture should, if you ask me, integrate nicely and support what we're doing at the individual level. So as our individuals move forward, so too is our organization, and we can both elevate together. If we're encouraging employees to get support by seeing a therapist, for example, then the organization should offer time off to do that, or should offer resources to have telehealth to make that happen. That's an example at a small level, but I think that can be driven very deeply within the organization, and that's something that we're very proud of doing at LAS, and one of the examples of things that we're doing. So that real strong integration between organizational systems and individual support, I think, is absolutely critical, and we have to stop walking in parallel.
Thank you for that. One of my favorite words is alignment, because in organizations, we often see that happening, right? We see parallel activities going on, but not a broader alignment. And if I could just throw in one more quick thing before I move over to Dr. Kearney. I have a little bit of a strategy background. In the strategy world, we say strategy trumps resource allocation, but culture eats strategy for breakfast.
Absolutely.
So I'm so with you on the strategy piece. If I could come back to Dr. Kearney and ask a little bit more about what you're doing in the center. I know you told us about which seems to be probably a really big number. I'm guessing 1,700 requests over the last couple of months. Sounds like that's probably a much higher number than what the center is used to. But if you've got some suggestions here that you'd like to share with us in terms of what do we do about this situation, that would be terrific. You're on mute, Dr. Kearney.
Yeah, I figure each of us will probably do that once before we're done. Thank you. Yeah, the biggest thing that I think when I think about how whether it's the immediate future in response to COVID or the longer future is the word integration. And picking up, I think Andi used that word earlier, that from our perspective as an agency, we really need to look at the whole person. When as I said, I've been here for 22 years. The agency's been around almost 50 years. And right from the very beginning, it offered medical, dental, and behavioral health care. But when I started, our medical building was on one side of a parking lot. Our behavioral health building was on the other side of the parking lot. And you would have thought that parking lot was filled with piranha. I mean, we never interacted with our peers. It just made no sense at all. But over the last 20 plus years, we have an integrated health record so that medical and dental are sharing the same information, which lets us very easily do medication reconciliation, things that could have been dangerous if we weren't talking to each other. It was almost impossible as a clinician to pick up the phone and reach a primary care provider. Not because they didn't care and they didn't want to work together, but everybody's busy. So having us literally sit in the same room together when we're not seeing patients, and when we are seeing patients, we're on the same hallway. So the patient sits in the waiting room and there's no stigma. Nobody knows, are they there to see a behavioral health provider? Are they there to see a medical provider? They walk in the same door. Because we found over the years, and it's not unique to us, it's well known, that a medical provider can make a great referral, but getting the patient to actually follow through with it is a big challenge. And a lot of that has to do with stigma. Some of it has to do with transportation. Some of it has to go with going to a unknown place. So I will just summarize quickly and say that I think we need to look for structural change so that we're bringing the two components together. We need to look at what are the barriers that are keeping patients from accessing care and do everything possible to remove those. And we need to have a big cultural change. We had to help our providers understand that no, you don't all get your same office to sit, your individual office to sit and do your paperwork together. You're all part of a team. It's team care. The patient's in the middle. We're all surrounding them and giving them what they need. And I think each of us in our own ways has to face those same basic issues.
I just love that, team care. And with that, I'm going to move over back to Bert and say, Bert, could you wrap up this question for us in terms of what are the suggestions that you have, that WellSpark has, in terms of dealing with this situation?
Yeah, and thanks, Dr. Kearney, for giving me a nice setup here, because I do think it does, some of the answer and the solution does lie in a team approach. I'll give you three ways that WellSpark is attacking this. The first thing is, we maintain that, again, that the classic benefit suite falls short. And so if you think about the EAP model, if someone is dealing with something, there is a big hesitance to call EAP, to call the number. You get a pamphlet, and then the person is kind of left on their own. So what we're proposing is that we create a new front door, and that new front door is a health coach model. And so that's number one. And we're encouraging employers to put in a health coaching program, which is much more positive than, why don't you call EAP? So changing the front door is the first step. And then once we have the person engaged, we're actually bringing some partners into our ecosystem. So whether that's talk therapy or social work or even chronic disease support, and making sure that individual is supported with the resources that they need to actually solve it, not just uncover it, but actually pull through to some solutions that would reduce stress. And if it is about family or relationship or chronic disease, that we're bringing the solution set to the front. So once they do come in that new front door, we have the resources right there for them. And then the last thing I'd offer is we're launching pilots right now. We have a client who's actually turning off some of these traditional benefits and moving to this model. And so we will be really focused on studying the impact of the new model and seeing if we can, in fact, improve absenteeism and productivity presenteeism. Now, this is where budgets factor in. So if you can turn off some of the other benefits and go to a stronger health coaching model, it makes it revenue neutral or budget neutral. So we're about to study this right now. So bringing resources to this new front door and then studying the impact, that's what we're doing right now.
Beautiful. Thank you. So we are in pretty good shape. I think it's 12:34. And so I'm curious, I'm happy to pick up on some of these themes and go around again and ask, or I can leave it open here a little bit in terms of, does anybody want to reflect on, I heard culture, integration. We've been very separate for a long time. And I also heard, or maybe I wrote it down after I heard another word, but stigma. Stigma is here. Dr. Kearney got to the stigma topic. And Bert, you alluded to this when you talked about your client that has 500 people, but only 3 are calling EAP. So, is it time for a new model? Of course, we're a disruptor. We think it's time for a new model. How do you, one thing that I think of is, what's the impetus to get started? How do you move off the dime? And Andi, you look like you're ready to jump in. So I'm going to go to you and ask you to respond to that.
Yeah, I have so many things, but I'm going to try not to take all the time. But I want to just say that, I do think that the shift right now is that employers have to take more social responsibility. And, the reality is the employer knows and has a deep understanding of their demographic. They know what the needs are of their people. They have a captive audience. And I think, in the past, employers have been, I sit in the head of HR seat. I know liability and I know risk. And I can say that, in the past, it's been really difficult for employers to cross the barrier of provider, care, health, and it's always been this separate thing. And as a result, I think employers have easily been able to hide behind that and say, not my problem, you have healthcare, go figure it out. And I think that's the disruptor from the employer perspective. Like, it is time for employers to say, no, I need to take care of my people, not because my claims are too high. Listen, we spend $10 million a year in claims. Obviously, that's an issue. If our CEO is here and listening, he would say, we're working on reducing our claims. Like, there's no question that's the business model. If he is listening, you know how I feel, Al. But, so I'm committed to the cause, right? I'm a business person. But at the end of the day, like, there's the model, if you have heard of it, conscious capitalism, and the model is elevating humanity through business. Like, it's time for more employers to take responsibility for offering health coaching, for creating dialogue, for their leaders to start stepping back and saying, you know what, I get anxious too. I'm scared. I hope that we can work this out together. For organizations to take a look at their values and say, wait, is self-care here? And if not, why not? And for us to look at the systems and the processes and say, I can take more responsibility for improving care. And I don't think we can hide anymore behind the idea that we, HIPAA and employers shouldn't know, because, I believe, we've figured it out. We've had health coaches fully employed by LAS for the last 3 years, and we've seen significant improvement in our costs of claims, of course, but just in general, like, I know that there are workarounds for those things to ensure that employees' information is protected, while at the same time we take responsibility as an employer to say, we care about you as a human enough for us to build the resources, and also, frankly, to make information, tools, resources, and education accessible to people all the way on the front line, regardless of where they live in this country, and have an opportunity to get care in a way that makes sense to them. So I know it was like, that was a lot, but you can see I'm passionate about this. I think it's employers can't hide anymore. We just can't do it.
Well, that's a fantastic response. Of course, I have to take advantage of this opportunity. You mentioned conscious capitalism. I'm a big supporter. I was the vice chair of the Conscious Capital Group here in Connecticut, and was a leader to bring that philosophy here to Connecticut. And just quickly to jump on that for one quick second, what Andi's talking about is really a social enterprise mission-driven approach, which says, we can do good and make money. They don't have to be separated there. And so social cause, which is, of course, I think everybody on this call today, all of us coming from different places, though, see the real need to combine all of these things, to bring the mental health component and the compassion to the businesses to help our people. One other quick thing before, again, I offer and open this up to the other two folks on the line. Amy had mentioned I went to the Harvard Business School in the 90s, and I can tell you that one of my favorite bodies of work was happening up there in the 80s and 90s. And that work, essentially, some of it done by Sasser, Schlesinger, there's a number of people. There's a book called The Service Profit Chain that essentially talks about, and the philosophy is, if we take care of our people and they take care of our clients, it's all going to drop to the bottom line. So these things are complementary. They are not in conflict. So anyway, I'm getting a sign that I need to engage my other panelists here and get some more questions going. Is there anything that the panel wants to ask based on the remarks of the other panelists?
Well,
or we can.
Colleen,
Yeah,
I'll jump in. I'll bite. I listened to Andi and around culture, and I agree with that. And you've heard me say that employee benefits suite needs to change, but I also think that we have to have a renewed focus on preventive care. And I'm not talking about classic, get your flu shot, get a gift card kind of programs, but really focusing on, if someone has been diagnosed with a chronic disease, how do you keep them on a good path? Because I'm blessed not to have one, but I just hear how difficult it is to stay on a good path day in, day out. And I just think, if you think about a health plan, and WellSpark certainly comes with deep roots from our parent company, both Connecticut and Emblem, but they're focused on what are the high cost claims, what are our network discounts, how do we get people to the right setting when they do get sick, and we propose you look at the other side of the coin and go upstream and say, what if you've been diagnosed with a chronic disease? How do you keep people on a good path and invest in that segment of your workforce as well? So not just the sick, not just your healthcare costs per se, So it's a combination of this coaching concept that we talk about, the culture that Andi talks about, and for us too, it's a focus on, again, biopsychosocial, but for that segment of the population that may need some extra help around managing a chronic disease. Because if you can support and help them in what they're dealing with, you know, that trickles out in many, many ways, especially if that employee is going to be with you for the long haul.
Mm-hmm.
Yeah, exactly. We know that, and this is a triple win, right? We can improve health outcomes, we can improve quality of life for people, and at the same time we can lower our ultimate claims and healthcare costs. So of course, to me, I think this is a no-brainer, if you will. Dr. Kearney, did you want to weigh in on this as this conversation evolves?
Yeah, what I'm hearing is fascinating to me, because you are all coming at it, as you've said, from different lenses. And I'm hearing very similar issues to the ones I address, whether it's with the individual patients I might be working with, or with the staff. We have a staff of a little over 200 in behavioral health that I oversee. And I hear some of these same issues. Certainly when we went over to all remote, and we made a commitment as a broader agency, we have about 1,200 employees across the board in the health center in 3 states. We made a broader commitment that we were not going to have any layoffs at this time, which was a challenge when our whole dental department was essentially unable to do the work it was typically doing. We switched them over to doing COVID screening and things like that. But my staff asked me, and rightly so, on the one hand, you're saying, see as many patients as possible because the need is tremendous. And because the financial reality is the more people we see, the more money we bring in, and that's a good thing at a time like this. And you're also telling me as a behavioral health provider, take care of yourself. You know about self-care, make sure you do it. And we had to address that right up front. And the common theme I'm hearing is the need for some culture change. The ability for everybody to say, healthcare is important, mental health is important, identifying those people that are great employees, but may have some challenges in their life. How do they manage that? And how do we all learn how to help our employees handle that? And part of that is creating an environment. Frankly, I have employees that will never call the EAP, no matter how much I tell them how useful it is, because they tell me, well, then everybody at work knows what my problems are. And no matter how much you say about that wall, you got to change the culture, because you can offer the best support possible. But if the employees don't believe it's there for them in a way that they want to receive it, it's not going to be utilized.
Absolutely. And that's a tall order, but at the same time, it seems as if, for example, obviously Laz is extremely progressive here. I just love hearing that you've had health coaches right in the organization, and that you're partnering with Bert on wellness products. This is terrific. I do believe it's time at this point to open up the line and see if we have some questions coming in from those that are on the line. Margot, are you going to take a look to see if we have questions, please?
Yes, I will. And we actually have 3 questions. The first one is tied to, how do you get your organization to see this as a benefit?
Okay. Thank you. I think everybody.
I can answer that. If you want, I can answer that. I mean,
please.
Like all joking aside, you know, obviously financial well-being for the company is often overshadows the need of the individual. So Bert alluded to this, but I do think that it is about strategy and taking a step back and saying, like, what are we actually using? What costs are being buried? We went through an exercise a few years ago where we said, let's dig into, let's push transparency at the nth degree through our broker, through our negotiation of benefits, both health, dental, and of course ancillary, life or disability, all this. We did a full analysis and a push to transparency, pharmacy, and we said, where are your varying costs? And we will not partner with you unless we can figure that out. So number one, we were able to do our best. We began this transformation to find dollars somewhere buried, because I promise they're buried somewhere. No offense to any healthcare provider, I mean, any of our partners that are out there, but the reality is, like, you know, those carriers out there need to make money too. So they'll often come up with these models. So that's number one, is like, you've got to know what you have included in your benefit packages, and where you're actually, you know, an administrative cost, what's buried in that, and know what that means, where your pharmacy rebates going, all that other business. And then the second component of it is the reality of some of the things Bert alluded to in terms of, you know, productivity and general leadership retention, those types of things. I mean, they're sort of esoteric and somewhat difficult to measure, but the reality is, if you have a really strong person you can partner with, and either internally or find a consultant with this kind of lens to dig into this stuff, you'll find cost of hire, you'll find some real hard costs you can offset with justifying. And then lastly, I'll say I'm a strong advocate of pilot. And so the pilot is clutch. And we did a pilot for our health coaching up front, and we did what's called the Whole Life Project. I'll spare you the details, but focused on the idea of putting a certain small few people through a program, and then we measured and benchmarked and all that other business along the way. And that was really the beginning of what I would say was a steep curve up, or a steep trajectory up of financial benefit to the company. That was, we were able to then continue to cycle in and more. So be strong, you know, be deliberate and be assertive with your carriers and your brokers if you're out there negotiating. I can't stress that enough. I think many of us in HR, if you're in HR and in a leadership role in your organization and have responsibility, it is your responsibility as an employer to know what your employees are getting. And a lot of times we don't know what we don't know, so we don't ask questions. And if you don't ask, you won't know. So I think that's a really important component.
Colleen, if I may,
yes, please.
I'll jump into that conversation through my lens, and I'll use Andy's comments to step off of. You know, I don't even want to use the word wellness in what we're talking about sometimes, because there's such a perception that wellness programs have no ROI, and there's been actually more written about the lack of an ROI with wellness programs than there has been an ROI. And especially where brokers and consultants and intermediaries between carriers or service companies and employers, their job obviously is to protect the employer, and, you know, where's your ROI? And I actually want to change that conversation too, because if you're looking for me to take $1 of what you spend on my program and pull it through to medical cost, there's so many variables in that equation. So I'll leave that right there. But there is an ROI on disease prevention. And when you go Google diabetes prevention, and the American Medical Association has a tool to calculate the value, if you invest $1 in a diabetes prevention program, what it will return to you. And so I love that it's there, because I don't have to defend my own calculation. I'm just saying, go out, it's the AMA. There's proof out there for ROI. And then last but not least, again, I'm trying to change the conversation and the narrative here to say, you're looking in the wrong spot. You're looking in the wrong spot. You should be looking at things like absenteeism and again, the cultural measures that Andi talks about. So I'm trying to change that narrative too, and disrupt the conversation, not just in a benefit offering, but the way it's measured. And because I do think that there's meaningful gains for every $1 you spend on this. Sorry, it's my soapbox.
No, it's wonderful. I love the passion from all of you. You're so committed to this. Shall we, Dr. Kearney, did you want to weigh in, or do we want to go?
We have two more questions and about,
questions. Yep. Okay.
So feel free to weigh in, but I just wanted to make you all aware we do have two more questions.
No, I was suggesting we move on. Yeah, that's a good idea.
Okay.
Okay.
Perfect. The next question is, what would you recommend for employees who are feeling more anxious and seem to be more isolated during this period?
Let me jump in on this one, just because it's a little bit more clinical, and then I'd love to hear what you all are seeing from an organizational perspective as well. And the first thing I think relates to something I said earlier. This is a normal response to an abnormal situation. And the more people can realize that, and I think you all and all of you that are listening are in a position to say that to your employees and your family and yourself, that there's no shame, there's no horror in what's wrong with me that I'm experiencing more anxiety or more fears or those other symptoms that I talked about earlier, because that's simply the reality of what we're all going through right now. It's playing out a little bit different for each of us, but we're all going through it. And I think it was Andi, somebody said earlier, just the importance of a growing sense of transparency in the workplace, to be able to be human and not share all the details of everything that's going on in your life. That's not appropriate. But when someone seems to be having a hard time, just say, yeah, we're all having hard times in our own ways. And so that's one big thing, realizing that it's normal. The other thing that I have found helpful with people is saying, COVID didn't change everything about you and everything about your world. Changed a lot, but didn't change everything. What used to help you with anxiety? What used to be a strength? Is there a person you can reach out to, an activity you used to enjoy? It's certain things we can't do, but most things we still can. So what are your resources? What are your strengths? Don't let the current pandemic, the current shortages, the current things that are squeezing you take away all those things that used to give you life. And I will leave one last thought, and a friend of mine told me this years ago in another context, and I've always found it very useful. Make a list of 10 things that you know give you life, encourage you, strengthen you, help you do well, help you deal with anxiety, whatever the presenting problem is. Make that list, put your pencil down, get up and walk around once, come back to the list and write down when was the last time you did each one of them. And that's going to be a shocker, because we all know the list of things that will make us feel better, and we're all not doing them. And so that's my challenge now.
The shoemaker with no shoes, right? I think there is one more question we have. Is that right, Margot? Why don't we do that? And then if we have extra time, we can weigh in with more comments.
Yep, the last question I have thus far is, how are you supporting those who might be losing their medical and dental benefits, as that's also a large stressor for people right now?
All right. Who would like to volunteer to go at that? Andi, did I see you would
Yeah, I was going to say
that too?
We definitely have had this at LAS in full transparency. COVID, people aren't parking cars out there right now, and we are a parking company. So, suffice it to say, we've had to have a significant reduction in our workforce through furlough over the last 6, 7, 8 weeks. And so almost 900 of the people who we had to furlough had health benefits with us. And so, as you can imagine, as a conscious capitalist company, and a company that's been so people first focused and never experienced layoffs, even at the worst economic times before this, it's been heartbreaking and difficult. And so what we decided to do is, because we are self-funded, we have some flexibility in the way in which we consider COBRA and the cost of COBRA. We paid the cost of care, obviously, for our employees through the end of the month in which they were furloughed, and we continue to do that. And then we offer a 50% subsidy for the cost of COBRA for at least the next 2 months beyond that. So we were able to, and from our lens, as a self-funded organization, it's a wash, really. You lose a little, you gain a little. And ideally, at the worst case scenario, it's not a huge financial impact, but it goes a long way for our employees. So we were able to provide a subsidy for the cost of COBRA. And then what we have been doing is we have a very strong communication campaign that we do every week for all of our employees who have healthcare with us or are enrolled in a plan with us. We've continued that to our employees who are furloughed, and continue to reach out to them on a weekly basis through both that campaign as well as through a tree of varying communication tools and resources. And so to the degree, and we've just acknowledged, we wish this was different, and we're here for you. We continue to offer them the EAP resource. Suffice it to say, I don't love EAP, but that's a different webinar, but at least it exists and we're offering it, as well as obviously our health coaching. We are continuing to offer to all of our furloughed employees who have benefits with us. So I realize we're almost out of time today, but I'll offer out, if anyone wants to reach out, this is my soul's purpose is to help other people elevate humanity through business. So if anyone wants to reach out to me separately, go to the WellSpark website. You can find me. I'm happy to offer you some ideas.
Beautiful. Thank you very much. We have just a couple minutes left. I thought maybe we just go around the room here again. Bert, do you have any last one line, two line that you want to make sure that the folks on the phone hear today?
Just that, you know, we're in a new time. I use the analogy all the time that the snow globe has been shaken. Mm-hmm. And I think it's time, new times call for new models. And so we've had our program and our philosophy about this biopsychosocial in the market for a couple of years now. But boy, I feel like the world is now in need of what we do more than ever.
All righty. Thank you. Dr. Kearney?
Yes, thank you. I think the whole importance of bringing together the various streams of healthcare, medical, dental, behavioral health, is something that federally qualified health centers have been doing for a long time. Certainly we have at the community health center, but a lot of private practices, a lot of medical and behavioral health people both are reaching out to each other. It's a movement, it's time, and I would just encourage everybody to get behind that. We need to get rid of the silos. It's the best possible care for our patients, and as everybody's been saying here, it pays off in increased wellness.
Fabulous. Absolutely fabulous. Andi, did you have one more thing that you wanted to share with the group?
I'll just reiterate what Dr. Kearney said, which I loved. I'll say it in a different way. The issues are different, but you know, the world is different, but the issues are the same. And allow us all to offer ourselves compassion and grace and kindness, because you know the world is changing, but we're still us. And you know, put your own oxygen mask on first. When you do that, you get to encourage other people to do the same. So you know, take your own self-care seriously, and when you do that, it sets an example for everyone else around you.
Thank you for ending us on such a uplifting high note. I would just like to thank the entire panel for sharing your expertise and your thoughts today. It's very informative and provocative conversation. And I will end with, yes, please, let's disrupt, let's pilot, let's try some new tools out there and see if we can make a difference. So with that, thank